will be fair and that the distributors will carry out their duties justly and they are assured of their turn in a transparent way, people will be more measured and will not rush for the food in a manner of the survival of the fittest. We must also be mindful of what happens to people who live with disability in circumstances such as this. We must also prioritize in order that the food items reach all, especially women, children, pregnant women, and nursing mothers. There have also been unfortunate reports of demands for party affiliation as an identifier for free food bought from the resources of the state. This must end and end immediately, because coronavirus is no respecter of parties. It does not know the MPP or the NDC. Neither does it know CPP, PNC, PPP, or APC, and all the other parties that exist. In order to ameliorate this challenge and ensure transparency, I reiterate my suggestion that the government must actively involve the traditional authorities, assemblymen and women, civil society organizations, and local civil society organizations and NGOs, in addition to faith-based organizations, to steer and ensure fair, equitable, and non-partisan distribution of food and essential items to the vulnerable, including persons living with disability. These critical stakeholders I've mentioned know their communities better, and they know those who really need support. And so let's involve them now. Accordingly, I have in view of the situation procured and will be making available food items to cater for a total of 20,000 households in the areas affected by the lockdown. These include Greater Accra, Kaswa, and the Greater Kumasi area. Apologies to His Excellency. Ladies and gentlemen, items, rice, oil, vegetable oil, and canned fish will be delivered to our traditional rulers in the lockdown areas, the Ghana Traditional Council, the Tema Traditional Council, the Kpong Traditional Council, the Utu Senya Traditional Council, the Asantemang Council, and the Council of Zongo Chiefs in both Accra and Kumasi, and the umbrella bodies of faith-based organizations and people living with disability. We count on all these bodies to coordinate and manage a fair distribution of these items to households in their areas. I'm requesting the chiefs to work actively with their assembly members in the affected areas in order to ensure that the items get to the people who need it and that these items are delivered directly to their homes. There must be no gatherings and large crowds at the palaces or any location in a manner that negates the country's efforts towards managing the COVID crisis. I wish to thank our sponsors who prefer to remain anonymous for covering the cost of the items that we are going to supply. Just as I came to the aid of our health workers when there was a dire need for protective clothing, this support will cover some 20,000 households and must be carried out in a fair and just manner without any parochial considerations. This is my widow's mite to support our people in these difficult times. We are all in this together, and we should take care of one another, no matter where. We are one people bound by one love, and this is a time for us to build bridges, not barriers, to bring love, hope, and trust, not hate and mistrust. I wish on this note to reiterate my call for a broader participation of traditional leaders, heads of faith-based organizations, assemblymen and women, and local CSOs in the efforts at contact tracing, surveillance, and public education in respect of the COVID-19 disease. In this regard, I call on the President to urgently meet with the National House of Chiefs and solicit the support of our chiefs in this regard. This is also important considering the reported resistance communities are putting up against the use of facilities in their area for setting up isolation centers. My brothers and sisters, the worrying trend of the increase in confirmed cases of coronavirus infections, 566 as at yesterday, so far calls for a dedicated commitment by us all towards supporting the fight against the infection. The latest extension of the lockdown period is accordingly appropriate. We must help our security personnel to enforce the directives and ensure that movement during this period is minimized in order to stop the spread of the virus. Considering the new cases being discovered, it is clear that we are entering a new phase where there is the beginning of a horizontal spread of the disease. This requires us to redouble our efforts in the battle against the pandemic. More testing centers need to be set up in order to shorten the waiting time for results. This is important so that the appropriate models of the expected trajectory the disease will travel can be developed in order to guide any decisions on easing the restriction of movement of people. We must set up a national COVID-19 command center equipped with appropriate communication systems and a bank of telephone lines, with volunteers keeping in touch with persons who are in quarantine, persons who are in isolation, and those who are awaiting results, and those suffering symptoms of the disease. Contact tracing is very critical in this phase of the fight against coronavirus. Reports that persons engaged in contact tracing are threatening to cease work are worrisome. And so government should take steps to appropriately incentivize these people so that they can continue the crucial work that they are involved in. We must also watch out for the increasing stigma developing around this infection. There are reports that persons who have tested positive have fled their communities because of fear and ignorance about the disease. This development of flight of suspected cases can hinder the fight against the virus, especially in the light of the estimation of the Center for Disease Control that one infected person has the potential to infect as many as 500 other people. Public awareness needs to be stepped up. Messages must be developed in all major local languages, and these should be played extensively on all media of mass communication, public and private. Government can utilize a clause in the NCA Act that compels media, both public and private, to provide airtime to air messages such as this in times of emergency. This clause proved useful during the fight against Ebola and can come in handy again at this time. There are increasing reports of the benefits of wearing masks to prevent and slow the spread of the disease. Examples are given about how the low rate of infection in the Czech Republic is because of the widespread use of face masks. In an earlier suggestion, I advocated for local dressmakers and garment companies to be used to produce millions of reusable face masks for free distribution to the public. Persons entering public places or gatherings must be compelled to wear these masks. These masks must be washed every day and pressed with a hot iron so that it is ready to use on another occasion. Surgical masks and other professional masks must be reserved for our health personnel. I acknowledge government's response to the call of the Ghanaian people to implement a raft of policy interventions which seek to reduce the unintended consequences of the pandemic on our people. In order for us, the people of Ghana, to realize the needed benefits from the subsidies on electricity tariffs announced, I urge the President to assure and fund the Electricity Company of Ghana and the power producers to enable them discharge their duties without interruptions due to inadequate funds to purchase fuel to produce power. In the face of significantly lower global prices for crude oil, I reiterate my call for a temporary reduction in LPG prices to enable households opt for its use in these difficult times when their incomes have dwindled due to the lockdown. It has also emerged that the definition of who a frontline health worker was not properly thought through by government when the president announced the motivation package. This issue is demoralizing and demotivating many a health worker, and I suggest that a discussion with the Ghana Medical Association and other professional health-related unions would achieve a consensus on how the incentive package can be utilized. The Ghana CD 80 million from the stabilization fund that has been budgeted for this purpose can be applied more fairly to maintain the morale and esprit de corps among our health workers in these crucial times. This might also be the time for government to employ more doctors and other health workers in waiting who have been idling at home, some for several years. This might become necessary as many health workers who suspect that they may have been exposed to the virus have begun to self-isolate in order not to further spread the disease. Similarly, our security personnel have been complaining not only about the quality and frequency of their food rations, but also their COVID-19 duty allowance. It is important for government to address this urgently in order to maintain the morale of the officers and men engaged in this important national exercise. Because just like health workers, they also risk their lives to interact with the public during this pandemic. It will be useful to also provide them with reusable face masks, gloves, and sanitizers for their own self-protection. At this point, government has not yet addressed the need to negotiate with the telcos for a reduction in their tariffs to benefit the millions spending longer hours online and making calls. As I speak, several students and pupils are having lectures and school lessons online because of the coronavirus disease. This has drastically increased their expenditure on internet usage to the extent that some can no longer cope. Indeed, there have been reports of several students who are unable to complete online lectures because their data ran out. Several people are also working from home. Due to these pressing needs, I wish to bring the issue of internet and voice services back as another priority on the agenda. I've already suggested that government can assure the telcos of a free 6-month extension of their licenses, some of which are said to be expiring soon. This value can be applied to cushion consumers during this 3-month period. Additionally, the telcos can also be compensated with funds from the Ghana Investment Fund for Electronic Communications, GIFEC, which already has the mandate to ensure universal access to telecommunications. Furthermore, the National Information Technology Agency, NITA, should leverage its robust broadband infrastructure, 4G cell sites, and optic fiber cables, a lot of which were deployed during my time, to meet the increased demand for wireless and fixed broadband services in these COVID-19 times. Also, the removal of the 50% increase in the communication service tax, CST, will provide further relief for the many who are having to work or stay at home at this time. The issue of, even though water tariffs have been absorbed for the next 3 months, there have been loud complaints of interruptions in the supply of treated water through pipes or by water tankers. I urge the government to redouble its efforts in this sector in order to give meaning to the campaign for regular hand washing with soap and the running water. A further measure which will go a long way to cushion SMEs and individual Ghanaian families would be for the Bank of Ghana to open a dialogue with the banks and financial institutions to offer a 3-month moratorium on payment of debts to the banks by their borrowers. I understand one bank has already voluntarily announced such a concession. This will be helpful at a time many Ghanaian businesses are shut and breadwinners of families have had to stay at home and therefore cannot earn an income. It is also time to explore the role of alternative medicine and traditional remedies in the fight against the coronavirus. Some traditional medicines are known to boost the immune system and can help both in the prevention of people succumbing to the disease and also play a role as a palliative function in the management of persons suffering with COVID-19. It is predicted that this pandemic and disruption of global trade and economic activity will adversely affect the economies of developing countries. Ghana is no exception. The fast-track approval by the IMF of the highly concessional rapid credit facility is therefore timely and very welcome. This will help cushion the economy from the dangers of recession. Our economy has revealed from this COVID stress test that it is still fragile and we need to be prudent in how we manage going forward. We must also be diligent in how we apply the 1 billion facility as the various tranches are released by the IMF. We face significant pressure on our local currency, declining domestic revenues, a slowdown in GDP growth, increase in deficits to GDP of between 8% to 9%, a ballooning debt which is projected to hit almost 70% by the end of the year. This scenario requires that we exercise strict prioritization in our borrowing and our expenditures. And this might be the right time for the President to consider trimming the bloated size of his government. At this critical time, the most crucial need of our health workers is the supply of PPEs. When I donated PPEs to the health facilities in the various regions, I advocated the need for government to urgently supply adequate PPEs to protect our health workers. I further requested that our national strategic medical stock should ensure that at all times such items as PPEs and other vital logistics are in place well in advance of future outbreaks. The initiative to have local manufacturing companies produce PPEs is welcome and must be speeded up. This can be done, and we must kickstart the effort more robustly now. Ladies and gentlemen, wherever you are listening from your homes, I wish to thank you for your time, and I wish to thank my media friends, cameramen, and other technical staff who have made it possible for me to reach out to you in your homes and your workplaces. Thank you, Weasel TV. Thank you, XYZ TV. Thank you, JoyNews. Thank you, Power FM. And thank you, Volta One TV, for this live broadcast. May God bless our homeland, Ghana. Thank you. I also wish to thank the many members of the NDC and sympathizers and all the donors and sponsors. I want to thank them once more, who contributed to make this support to 20,000 households possible. May God richly replenish you and bless you. We are not in normal times, but together we will win this fight. Akwenami, minda mofia moshi, mida ubia ase, nagode, alite maka.